You sit down to watch the evening news. You cross your legs to get comfortable. Within 20 minutes, your foot starts tingling, and by the time you stand up, your leg is asleep and you're unsteady on your feet. You think it's just normal, just what happens with age. But here's the truth. That tingling is your circulation being crushed. And if you keep sitting that way, you're setting yourself up for blood clots, chronic swelling, and damaged veins that may never fully recover. I'm Dr. Serena Serrati, and as host of Dr. Serena Serrati Senior Health, I want to talk directly to you if you're over 60 and spend a lot of time sitting. You're not doing anything wrong by sitting. It's a normal part of life, especially with reduced mobility. The problem isn't that you sit, it's how you sit and how long you stay in one position. Today, I'm going to show you 5 common sitting habits that quietly crush your circulation and the exact corrections you can make right now while you're listening. Here are the 5 habits so you know exactly what's coming. Habit 1 is crossing your legs or ankles. Habit 2 is sitting with a wallet or phone in your back pocket. Habit 3 is slouching or sliding forward in your chair. Habit 4 is letting your feet dangle without support. Habit 5 is sitting completely still for hours without any movement at all. By the end of this video, you'll know how each of these habits strangles blood flow to your legs and how to correct them in 30 seconds or less. You'll also know how to build a simple routine to protect your circulation every time you sit down. And you will probably feel an urge to adjust your position several times as you listen, which is exactly what I want for your legs. Stay with me and let's protect your circulation together. Here's what makes sitting so dangerous for circulation, especially after 60. When you sit, your body weight presses down on the backs of your thighs and behind your knees, right where major blood vessels and nerves travel. If you add poor positions like crossing your legs or dangling your feet, you literally compress those vessels and slow blood flow. After 60, your blood vessels are stiffer, the valves in your veins are weaker, and your muscle tone is lower, so your legs can't compensate as well for that pressure. Think of your blood vessels like a garden hose. If you sit on the hose, the water doesn't stop completely, but the flow drops dramatically and pressure builds up behind the pinch. That's exactly what happens when you sit in a position that crushes your circulation. Within about 20 minutes in a bad position, circulation can drop significantly, blood pools below the compressed area, and your clot risk goes up. Let's start with habit 1, crossing your legs or ankles. This is one of the most automatic habits people have. You sit down, and before you even notice, your legs cross at the knees or ankles because it feels comfortable and familiar. You may have been sitting this way since your 20s and never thought twice about it. When you cross your legs at the knee, you're compressing the blood vessels and nerves behind your knee, especially the popliteal artery and vein. Those are the main pathways carrying blood down to your lower leg and back up again. Within 15 to 20 minutes of crossing your legs, blood flow can drop by 30 to 40% in that limb. Your calf and foot aren't getting the oxygen and nutrients they need, and the blood that can't move freely starts to pool below the compression point. You've felt the warning signs of this many times. Your foot starts to feel heavy and then falls asleep. You stand up and get that sharp pins and needles sensation. And sometimes you feel wobbly for a few steps. That's not just getting older. That's your nerves and blood vessels complaining after being pinched. Over months and years, this repeated compression can damage the valves in your leg veins and contribute to varicose veins, chronic swelling, and a higher risk of deep vein thrombosis, the blood clots that can travel to your lungs. Here's what I want you to do instead. Look at your legs right now. Are they crossed, even just a little? Uncross them right now. Plant both feet flat on the floor, about hip-width apart, with your knees at the same height as your hips or just slightly lower. If you absolutely feel you must cross something, cross very loosely at the ankles only and for a short time, then uncross again. The safest, circulation-friendly default is both feet flat on the floor, not crossed. I want you to feel this difference in your own body. Take a second and notice any tingling, heaviness, or numbness in your feet or calves. Now that your legs are uncrossed, leave them that way for the rest of this video and see how they feel by the end. Each time you catch yourself crossing your legs from now on, quietly tell yourself, feet flat, veins happy, and uncross them. This simple habit change alone can dramatically protect your circulation over time. Now let's tackle habit 2, sitting with a wallet or phone in your back pocket. This one sneaks up on people, especially those who have carried a wallet in the same back pocket for decades. You sit down with a thick wallet or phone under one buttock and stay there through meals, car rides, or TV time. It feels normal to you because you've done it for so long. When you sit on a wallet or phone, you create a hard pressure point under one side of your pelvis and buttock. That pressure squeezes blood vessels and also compresses the sciatic nerve, which runs from your lower back through your buttock and down the leg. This can cause irritation and inflammation of the nerve, sometimes called piriformis syndrome, leading to pain, tingling, or numbness down the leg. It also reduces blood flow on that side, which can cause uneven swelling and discomfort. I want you to do a quick check right now. Reach back and feel your back pockets. Is there a wallet, phone, or anything bulky in there as you sit? If there is, remove it right this second. Put it on the table, in your front pocket, or in a bag. Your back pockets should be completely empty every single time you sit down. This is one of the easiest circulation fixes there is. Over time, sitting on a wallet or phone can create a pattern where one leg is more swollen, more uncomfortable, or more numb than the other when you stand up. Removing that object instantly levels out the pressure on both sides. If you commit to never sitting on a wallet or phone again, you often feel less deep buttock pain, fewer shooting sensations down one leg, and more even comfort when you've been sitting for a while. That's a huge payoff for such a tiny change. Let's move to habit 3, slouching or sliding forward in your chair. This often starts without you realizing it. You sit down nicely at first, hips against the back of the chair, feet on the floor, and everything feels fine. Then, as time passes, you slowly slide forward until you're perched on your tailbone with a big gap between your lower back and the chair back. Or you slouch into a C shape with your spine curved and shoulders rounded. When you slide forward or slump like this, your body weight shifts and concentrates on a narrow band across the backs of your thighs and the edge of the chair. Instead of your weight being spread across your whole seat and back, it's now pressing down hard on the blood vessels and nerves along the backs of your thighs. That includes the femoral vessels, which are major highways for blood moving in and out of your legs. You may see deep grooves, red marks, or indentations on the backs of your thighs after sitting like this. Those marks are your skin and tissues literally showing you where circulation has been compressed. Blood has a harder time getting down into your lower legs, and venous blood has a harder time coming back up. Fluid starts to leak out into the tissues, creating swelling, heaviness, and aching. On top of that, slouching compresses your abdomen, making it harder for blood to circulate freely through your core and back up to your heart. Let's correct that together right now. Pause for a moment and notice your position. Have you slid forward even an inch or two since this video started? Scoot your hips all the way back into the back of the chair so your lower back and buttocks are supported. Then gently lengthen your spine as if a string is lifting the crown of your head upward, without becoming stiff or rigid. Keep your shoulders relaxed and your feet flat and supported. Feel the difference in pressure on the backs of your thighs once you've scooted back and sat up. You should notice the pressure spreading across your whole backside instead of digging into one band. Over time, practicing this alignment can reduce thigh grooves, end-of-day heaviness, and discomfort when you stand up after sitting. It also helps your core and back feel better, which is a nice bonus for your overall function and independence. Habit 4 is letting your feet dangle without support. This happens a lot when the chair, couch, recliner, or car seat is simply too high for your body. Your feet don't quite reach the floor, so your legs hang with the backs of your thighs pressed hard into the front edge of the seat. At first it might feel like nothing, but it's a serious circulation trap. When your feet are dangling, the edge of the seat acts like a tourniquet across the backs of your thighs. The whole weight of your lower legs pulls downward, increasing the pressure on a small area where the chair cuts into your thighs. Blood trying to flow down into your calves and feet is partially blocked, and blood trying to come back up through your veins is squeezed at that same point. This is a perfect setup for swelling, discomfort, and long-term vein damage. Think about times your ankles and feet puffed up after a long car ride or after sitting in a high chair at a restaurant. You might have noticed sock marks that look like deep grooves around your ankles, or felt like your skin was stretched tight over your feet. That's your body showing you what that dangling position does over time. For some people, years of this pattern can even cause nerve damage in the thighs and more severe varicose veins. Here's the correction, and I want you to try it the next time you sit anywhere. Your feet must be supported. If your feet don't rest flat on the floor with your thighs roughly parallel to the ground, bring the ground up to you. Use a footstool, a small box, a thick book, or any stable object so your full foot is resting on something. Adjust until your knees are at about the same height as your hips or just slightly lower, and your thighs are supported along most of their length without a hard edge digging into them. If you use a recliner, pay attention to the front edge of the seat. If you feel a sharp line of pressure under your thighs, put a pillow or folded blanket under your thighs to spread out the pressure. If you're shorter and every chair seems too tall, keep a dedicated footrest in the spots where you sit most often. Over time, this small adjustment can dramatically reduce ankle swelling and that heavy, tight feeling in your legs at the end of the day. Now let's talk about habit 5, sitting for multiple hours without movement. This is incredibly common and incredibly dangerous for circulation. You sit down just for a bit to watch a show, and suddenly 2 hours have passed. You ride in a car for a long appointment day, or you fly to visit family and barely move your legs the entire trip. Even if your posture is perfect, complete stillness for long periods allows blood to stagnate in your legs. Your calf muscles act like a pump that squeezes blood up toward your heart each time they contract. When you're still, that pump shuts down. Blood pools in the lower legs, pressure builds, and fluid leaks into your tissues. That's why your legs can feel like heavy logs and your skin can look stretched and shiny after sitting too long. Here's the part that truly worries me. Stagnant blood is more likely to form clots, especially in the deep veins of your legs. Long periods of sitting still, more than 90 minutes at a time, have been linked to roughly double the risk of deep vein thrombosis, particularly in older adults and in people with other risk factors. This is one of the reasons long flights, long car trips, and long TV binges can be dangerous if you don't move. So here is your non-negotiable correction. Set a timer on your phone, watch, or clock for every 30 to 45 minutes anytime you know you'll be sitting. When it goes off, you have 2 options. Ideally, stand up and walk for at least a minute, to the kitchen, to the bathroom, or just around the room. That simple minute wakes up your calf pump and shoots blood back up from your legs. If you absolutely cannot stand, or you're in a situation where standing isn't realistic, do seated leg movements. Point and flex your feet 20 times like you're pressing a gas pedal and then pulling your toes toward you. Then do 10 ankle circles in each direction. Wiggle your toes, tighten and relax your thigh muscles. And if possible, gently lift one knee, then the other a few times. The key idea is simple. No more than 30 to 45 minutes of stillness. Movement is your built-in protection against pooling and clots. Now let's put this into an immediate action protocol you can use right now. I want you to do a full sitting self-check with me. First, look at your legs. Are they crossed in any way? Uncross them and place both feet flat on the floor, hip-width apart. Second, reach back and check your back pockets. If there is anything there, remove it now and put it beside you. Third, notice where your hips are. Have you slid forward in your seat? Scoot your hips all the way back so your lower back is supported by the chair back. Fourth, check your feet. Are they fully supported, or are your toes barely touching the floor or hanging? If they're dangling, find something to rest them on, a box, a bag, a low stool, and place your feet firmly on it. Fifth, pick up your phone or look at a clock and set a timer for 30 minutes to remind you to move. I want you to make this checklist automatic every time you sit for more than 5 minutes. Feet flat, not crossed, back pockets empty, hips against the back of the chair, feet fully supported, timer set for movement. Over time, this will become as automatic as putting on a seatbelt when you get in the car. You won't have to think about it. Your body will just know that this is how you sit safely. Let's talk about how to know when your sitting position is already crushing your circulation. Your body gives you early warning signs. If any part of your leg or foot feels numb, tingly, or asleep, your position is compressing nerves and blood vessels. If you look down and see one leg more swollen than the other, or deep indentations in your skin from socks or the edge of the chair, That's your body saying, too much pressure here. Another important sign is color change. If your feet look unusually pale, bluish, or very red compared to usual, that may indicate poor circulation or congestion. If you notice these signs after 15 to 20 minutes of sitting in a certain way, it means the position is crushing your circulation. The correction is always the same sequence. Uncross everything, plant your feet flat and supported, scoot your hips back, sit up more aligned, and then wiggle your toes and move your ankles. There are also situations where you must seek medical help, not just change position. If you develop sudden, severe swelling in just one leg, especially if it's warm, red, or painful, that's a potential emergency. If walking hurts in one calf more than usual, or it feels tight and tender to touch, you need to get evaluated immediately at an emergency department. Don't wait overnight or see if it gets better. These can be signs of a deep vein thrombosis, which can be life-threatening if not treated quickly. Remember, what we're talking about in this video is educational information to help you protect your circulation day to day. It's not personal medical advice. If you've had blood clots before, have peripheral artery disease, severe varicose veins, diabetes, neuropathy, or you're on blood thinners, your circulation is more fragile. These 5 corrections are even more important for you, and it's wise to talk with your clinician about optimal sitting positions and whether compression stockings or other measures are appropriate. I also want to make sure you understand that perfection isn't the goal here. You won't sit perfectly all day, and you don't need to. What makes the difference is catching yourself and correcting your position at least 70 to 80% of the time. That level of consistency is enough to significantly reduce pooling, swelling, and long-term vein damage. Think of it as building a protective habit rather than trying to be perfect. Now let's talk about some modifications for people with specific challenges. If you have hip or knee problems and feel like crossing your legs is the only way you feel comfortable, try a safer alternative. Sit with both feet flat and place a small pillow or folded towel between your knees. Gently squeeze the pillow so your legs feel supported without actually crossing and compressing the vessels behind your knees. You get comfort without crushing circulation. If you use a wheelchair or spend much of your day in one, pressure relief becomes crucial. Every 20 to 30 minutes, if you're able, push up slightly using your arms or adjust your position so the pressure shifts off one area of your thighs and buttocks. Even small shifts, leaning slightly side to side, changing the tilt of your pelvis or repositioning cushions, help protect both circulation and skin. Make sure your feet are supported on the footrests at the correct height so you're not dangling or overflexed at the hip. For those with severe arthritis or balance problems who can't stand often, double down on the seated exercises. Make ankle pumps and circles, toe wiggles, and thigh squeezes non-negotiable every 30 minutes. If you're in a recliner, you can also gently flex and extend your knees if comfortable. The key is movement, even if your feet never leave the footrest. Each contraction of the calf and thigh muscles acts like a little pump pushing blood along. Now, I want to give you a simple 7-day awareness and correction plan. For the next 7 days, every time you sit down, take 10 seconds to run through the checklist. Feet uncrossed, back pockets empty, hips back, feet supported, timer set. Once each hour, ask yourself, how am I sitting right now? And see if you've slipped back into one of the 5 habits. You are not judging yourself, you're just noticing. At the end of each day, take a moment to reflect on your legs. Do they feel lighter or heavier than they usually do at that time of day? Are your ankles less swollen when you take off your socks? Did you have fewer episodes of numbness or tingling? You'll probably be shocked on day 1 by how often you find your legs crossed or your hips sliding forward without realizing. By day 7, you'll start to find that your body reminds you sooner, and the corrections feel more natural and less forced. If you want accountability and community, share your experience. You might say, day 1, caught myself crossing my legs 10 times, and then, day 7, caught myself 3 times, legs feel lighter. That awareness is powerful. It shows you that these are not tiny quirks. They're patterns that, if left unchecked, can shape your circulation for the worse over years, but also patterns you can absolutely change. Let's review the 5 common sitting habits that crush your circulation and the one-line correction for each. Habit 1 is crossing your legs or ankles. The correction is simple. Keep both feet flat on the floor, hip-width apart, with knees level with or slightly below your hips. Habit 2 is sitting on a wallet or phone. The correction is to empty your back pockets every single time before you sit. Habit 3 is slouching or sliding forward in your chair. The correction is to scoot your hips all the way back so your lower back meets the chair. Then sit reasonably upright. Habit 4 is letting your feet dangle without support. The correction is to use a footstool, box, or stack of books so your feet are fully supported and your thighs aren't being cut by the chair edge. Habit 5 is sitting completely still for hours. The correction is to move every 30 to 45 minutes without exception, either by standing and walking for a minute or doing ankle pumps in circles while seated. These 5 habits are silent destroyers of leg health. They quietly strangle blood flow to your legs day after day, increasing your risk of blood clots, causing progressive vein damage, and creating chronic swelling and nerve problems. But every one of them is completely correctable starting right now. Check your position again as we finish. Uncross your legs if they've drifted, make sure your pockets are empty, hips are back, and feet are supported. Confirm that your next movement timer is set. If this was helpful, consider subscribing to Dr. Serena Serrati, Senior Health, so you don't miss practical, realistic strategies to protect your health and independence. Your legs will thank you for every small correction you make. Your circulation will thank you for every movement break you honor. And your future self, the one who still wants to walk comfortably, stand steadily, and avoid preventable clots, will absolutely thank you for choosing today to stop crushing your circulation and start protecting it.